Hello, I am Dr. Girish SP, Surgical Gastroenterologist at Aster RV Hospital, JP Nagar, Bangalore. Today I will be talking about inflammatory bowel disease. It is one of the, though not common, very disturbing disease for the patient who is suffering. So this comprises two aspects. One is called as Crohn's disease. The second one is called ulcerative colitis. Both are chronic inflammatory diseases. That means they involve and trouble the small as well as the large intestine for a longer period of time. It may start as an acute emergency, but it will continue to trouble the patient for a longer time. These two, mainly the Crohn's diseases, involve small intestine as well as the large intestine, but most commonly it involves the small intestine. Whereas the second one, that is called ulcerative colitis, it involves mainly or always involves only the large intestine. In the large intestine, it can usually start from the rectum, the last part of the intestine, may extend to any extent up to the cecum, that is the first part of the intestine, to variable length, and depending upon that, it is being classified into either the short segment disease or the whole length large intestine disease. Coming to the age of involvement, most commonly it involves the middle age of the patients. So there is no sex predilection. It can involve equally in male as well as female in women. And the age is, as I told you, it's in the middle age. It involves somewhere between 20s to 50s. Though extreme age also is not uncommon. We have found Crohn's disease in small children who present with intestinal, abdominal pain, etc. Coming to the symptoms, most commonly abdominal pain is the most common symptom. Most of them have a chronic abdominal pain which is undiagnosed. Most commonly we treat them as gastritis, but patient then continues to have something called diarrhea, loose motion, which is associated with passing of blood is the most common symptom. They may also have some associated symptoms like weight loss, nausea, vomiting, lethargy, and weakness in daily routine performances, etc. So when these symptoms are there, then we usually perform some diagnostic investigation in them. Most commonly, again, it starts with blood tests and then ultrasound scan abdomen. Then depending upon the location, we may perform some endoscopy and then CT scan, etc. Endoscopic diagnosis is the mainstay of the treatment for the diagnosis. If we do endoscopy, we may have to do a colonoscopy. Sometimes the small intestine, which is very difficult to access, we have facilities, something called enteroscopy, where under anesthesia we utilize a very long tube which can be used to enter the small intestine, and then by a mechanism called as railroading, we can examine the whole length of the small intestine and take biopsies from wherever it is, wherever there is an affected area. So, and histopathology is very important. Sometimes it can confuse with tuberculosis, etc. But with our specialist, with different kind of special stains and all, we can diagnose the Crohn's disease or the ulcerative colitis. Once we have diagnosed the problems, we have to treat them. Most of the time, it is treated medically with immunosuppression agents. These are not immunosuppression like cancer patients. Here, it's the immunosuppression is very mild to moderate. Sometimes we may add steroids for emergency control of the symptoms. But usually we should always remember that lifestyle modification and the medications are for a longer period of time, typically from somewhere between 5 to 10 years. In between there will be frequent visits and all, but if we follow the doctor's advice seriously, it can be taken under good control of the symptoms. The role of surgery is very common in Crohn's disease, whereas it is very limited in ulcerative colitis. In Crohn's disease, most of the time the disease tend to be very severe where the intestine can break down and cause perforation, and the infection can spread into the whole abdomen, or sometimes it can form something called a big inflammatory mass. In these situations, the surgery is very important. And as an expert center, we have laparoscopic surgery, where most of the surgeries can be performed by a minimal invasive technique. And coming to ulcerative colitis, we have some special surgery called as pouch surgery, which very few centers, including our center, this RV Hospital, does this surgery, this kind of surgery, where the whole large intestine is removed and the small intestine is made into a fold, and then it is attached to the anus. So where the rectum, the capacity of the rectum is replaced by the pouch, which is performed by the small intestine. This special surgery is very rarely done. We have the expertise to do this surgery, and the results are very good. Otherwise, patient has to live with something called stoma, thus ileostomy or colostomy for lifelong, which can be avoided. So this will help in better outcome and good lifestyle changes for the patient, so that the quality of life is much better. And most of these surgeries and these expertise is available in our hospital, and we are available at Aster RV Hospital 24 hours service and a whole week.